Okay, good morning. My name is Dr. Red. I work at the health department. I'm going to talk a little bit today about colon cancer. Colon cancer is a relatively common disease. When I was in private practice, I saw numerous cases of it, and unfortunately some of the people I took care of didn't make it, and I have a lot of respect for it. It's the number two leading cause of cancer deaths in the United States in men and women, behind breast cancer and prostate cancer. In non-smokers, of course, in smokers, lung cancer is the number one cause, but it really is a relatively common form of cancer, and something that fortunately can almost be entirely prevented. Colon cancer usually starts growing inside the colon, oftentimes in little polyps. And so if you have your colon here, here's your colon. Okay, colon is your large intestine. You might have a little growth on the inside of your colon called a polyp. And that polyp initially is not cancerous, but with time sometimes it can become cancerous. And so as you get older, you tend to have more of these polyps. You may not have polyps, but you might have polyps. And if you go up with a scope through the rectum, the doctor can go up there and actually remove that polyp without doing any surgery, which is just an amazing thing. So you can go in there, pick the polyp up, take it out, and actually prevent the cancer from ever happening in the first place. The other thing that happens with colonoscopies is sometimes you might not have any symptoms of colon cancer. You might have an early cancerous growth in the wall of your colon, and when you go in there with the scope, you'll see that cancerous growth, and then you can go to a surgeon and have that section of the colon actually cut out and have the two ends hooked back together. When that happens, you get cured of your colon cancer sometimes, but the best thing to do is catch it before it ever becomes cancer in the first place. The way you do that is by getting screened on a regular basis, starting at age 50 if you have no risk factors. And let's talk about the risk factors of colon cancer. Risk factors for having this disease are having family, first-degree relative like a mother, or father, or a brother or sister that has colon cancer. If that's the case, you should be screened before the age of 50, and you should talk to your doctor about that. But if you don't have any risk factors for colon cancer, then you should start getting screened at age 50, and you should do that every so often as recommended by the physician. But the colonoscopy is a simple procedure. It's not particularly dangerous. I've had it done 3 times myself because I've seen so many people die from colon cancer that I just don't want to go there. And I think it's something that people generally should do as soon as they turn 50 years old. It's just early detection and prevention by removing those polyps is a way to prevent colon cancer from becoming a major problem in your life. Thank you very much for